Before I start, I would like to recognize our management supervisors, staff, directors, managers, supervisors. I would really appreciate if you stand up, and all the directors, managers, and supervisors, so please give them a big hand because of their leadership. Sorry, we have to cut it short. Otherwise, I wish we had the time to introduce them individually, but you know, all of you want to go home, all of us, including myself, so we'll try our best to finish on time. And Brian is our timekeeper. I have to keep him happy too, so he's there. The next one I would really like to do is to recognize those folks who joined our team in the past 12 months. Would you please stand up? I know there are quite a few, and please give a big hand to them, all of them. Welcome to our family. And this is really the analogy, the best analogy I can give you for this meeting. It's like a corporation. At the end of the fiscal year, the corporation board of directors, they give a report to their stockholders, and that's the same thing we are doing here. You are our stockholders, and you made a huge contribution to our success this year. So everything starts with mission and vision. Of course, we need to know what we are supposed to be. So UMass mission, all of you know, just this is a redundant probably. Excellence in clinical care, service, teaching, and research. And our vision is to provide leadership so that we give the best possible care to our patients. And education, excellence, and research excellence. And how pharmacy makes a difference, because we really are the ultimate owners of medication management process at every aspect of patient care delivery, which is offered by our organization. And just going through the medication management process, most of you know this, and this is nothing new to you. Very quickly, if you look at the medication management process, that starts from the medication selection, ordering, physicians, pharmacists, they play a major role in this process. Then the next part is the dispensing process. That's where pharmacists play a major role there. Then our colleague technicians, they work extremely hard in delivering the medications in a timely manner. And as you know, in many cases, timeliness is very important to patient care outcome. We have an outstanding technician crew here at all of our cost centers, and their hard work really makes a huge difference in improving patient care outcome at UMass. Then the medication administration, of course, the nurses do it, but we also work on the background to make sure that they have the proper policies. We help them formulating it. Then the education, which is another big area. Pharmacists plays a major role, and we can do much better in that area too. The next one is the monitoring. We have to make sure that the patient's getting the right drug, right medication, appropriate, so that we can have a huge impact on that patient's length of stay. And again, pharmacists play a major role there. Whether you work in the inpatient setting or outpatient setting, the game is the same. All of us, we have to always keep in mind that we are working for the same patients. At the end of the day, all of us, we are here just for the patient. And all of us, we contribute to their outcome. So how did you do this year? Good news. Fiscally, this year was really good year for UMass. As many of you know that across the country, many hospitals, they are struggling. There have been hundreds of layoffs, including our colleagues affiliated with Harvard, Harvard University and others at Boston. And many places, the salaries were cut. Many things they had to do just for their survival. However, at UMass, our past strategies really made a huge difference. We are very successful this year. And with our continued teamwork, we would continue to be successful, no doubt about it. So the first thing is I would like to share where is the drug cost? Because this is a major issue that we have to meet our mission. And again, no mission, no margin. I'm sure you have heard that many times. So inpatient cost, if you look at the university, last 2 years on there, on the left-hand side, and you would see that it's really stayed steady. Inpatient cost per day at Memorial, actually it went down. Congratulations to our Memorial staff for doing a great job there. Oncology serve outpatient, inpatient, you'd see a huge cost difference. That's various reasons for it. So definitely we have some plans and we are going to address them. Inpatient volume trend at Memorial, we kept similar volume. University, it increased this year. Outpatient volume, you can see that our prescription center volumes really increased significantly in last 1 year. And oncology volumes also increased during this period. Cost savings, we have a presenter on this, so I would just like to make one comment. Back in FY07, we had cost savings secondary to that program, only 7 million. Now just within 2 years, it's $14 million. That's huge for this organization. That pays all of our salaries and our benefits, which is really a great program. Prescription centers, again, kudos to our staff there. Excellent service. We are seeing patient satisfaction service one after other. Really, we are doing a fantastic job. But what does that mean? Just from our employee prescriptions, these 2 prescription centers gave us about $5 million net profit, which means a lot. That really helped us to keep our jobs. We didn't have to lay off anyone in this organization. This is one area really did a fantastic job. Interventions. Pharmacists doing a fantastic job documenting interventions in specific meaningful categories. You can see these numbers in your handout, and really fantastic job. Really keep up the great work, and it really makes a huge difference on patient care outcome. So we have many, many stories to share. These are our partners. I'm very proud that they are sharing their experiences, so you would hear.